All right. Hello, everyone. So I'm Beatrice Arquette, and I am a member of the Youth Advisory Committee. And so I just have a few quick reminders before we jump into the next session. Remember to keep your phones on mute, and also note that we will be using the app as well for the Q&A portion of this session. So drop your questions on there. So now, what if we could see each other's silent struggles, especially those of young cancer patients? Often, we focus on their physical health, but what about their mental well-being? Marie Barnett, a psychologist from Memorial Sloan Kettering Cancer Center, will guide us through this important topic. She'll explore how these young people can understand and manage their emotions during these challenging times. Let's welcome her to the stage.
Hi. What a gift to be here together today. Okay, so if I could, thank you. So I'm going to talk about something everyone here has heard of, but really very few know and understand. It starts big and broad, and it's known across the globe. It does not discriminate by age, gender, race, ethnicity, or even lifestyle choices. And it's possible it can touch anyone at any time. Cancer. Those words, you have cancer. It also strikes me that all of us were or are children, adolescents, or young adults. I invite you to think with me about what I say today and how it might be connected to you or someone you know. Examined next to each other, cancer diseases among adolescents and young adults are one of the most serious health problems in the world. And as we know, mental health is a global public health issue that we all know and care about here. But with our, now imagine them together. Childhood cancers are rare. Cancers among adolescents and young adults, which I'll also refer to as AYAs for those aged 15 to 39, occur 6 times that of childhood cancers. Both are seen as unique, underserved age groups. With incredible treatments and growing access to clinical trials, funding, and creative medical solutions for both proactive and reactive medical care, survival rates from these cancers has only been rising. Representations of child and AYA cancer have also only increased in the media. These experiences and the impact of living with and beyond a cancer diagnosis are invisible and often unnoticed by the community and world around us. This includes family, friends, classmates, employers, teachers, neighbors. As a clinical psychologist at Memorial Sloan Kettering Cancer Center in New York City, I have the privilege to care for this incredible age group going through cancer treatment. It is a beautifully hard job. Developmentally, these individuals go through stages marked by rapid changes in cognitive and emotional growth. And these issues need to be addressed when considering medical and mental health treatments. AYAs in particular have to cope with cancer treatment while attaining key developmental milestones. These include autonomy, identity development, and initiating intimate relationships and establishing self-esteem and confidence. They may be making decisions about their career, about education, about starting a family, employment. That's a lot, and it's all invisible. Cancer is a gravity-shifting event. With the many things taken away, lost, or rendered seemingly impossible from cancer treatment, as a child or AYA in particular, or for their caregiver, one of them is often mental well-being. The addition of a physical illness comes with the addition of mental illness. The definition of a traumatic event itself includes cancer as an example. A traumatic event itself is linked with increased anxiety and mood-related disorders. Additionally, adjustment disorders are a valid and appropriate diagnosis for experiences that quite literally need adjustment to. That's important. Cancer-related issues can result in significant emotional distress and psychiatric symptoms, depending on age and type of treatment, like radiation or chemotherapies. A life-saving treatment may leave you with significant cognitive and developmental deficits. Psychological distress, such as anxiety, depression, or social isolation, are significantly greater among AYAs compared with older adults with cancer, and higher reported rates of psychotropic medications suggest increased emotional burden. During my first encounter with a patient and their family, I feel obligated to normalize that it would be weird or not so human if you were not sad, anxious, confused, or any combination. As a psychologist, I strongly believe in championing mental wellness within cancer care as striving towards the ability to be inclusive of all emotional states. They are all true. Sadness, joy, confusion, acceptance, loss, peace, and the whole child, their internal and external world. The invisible and psychological aspects of cancer can be much greater and more nuanced for children in AYAs because it is such a developmentally intricate period. Focusing on AYAs in particular, how can we better understand living with and beyond a cancer diagnosis? How do we see what is invisible? I'm a kid, I'm only 15, I just turned 21. It is in conflict because a healthy young person should not get cancer. How can somebody be healthy last week and today starting chemotherapy? Now, I know people are all full of contradictions, especially kids and young adults. But I observed cancer to create a unique type of dialectic, internally, both during and after treatment. Cancer itself puts this age group into a web of inherently dialectic ways of living and experiencing the world, and it travels through time, into survivorship or caregiver grief, through space and within relationships. Much of my work in therapy is to help put words to the dialectics of experiences, while at the same time understanding those normal experiences and challenges of being young. Over years spent individually with patients and caregivers talking about the lived experience with cancer, mental wellness is often tethered to this concept of dialectics, which is particularly poignant with cancer. A dialectic is when two seemingly conflicting things are true at the same time. At the heart of a dialectic is the idea that things are made up of opposites, and change is possible with a dialogue between opposing ends. This interconnection of things and the idea that opposites can be integrated are important elements of thinking therapeutically about dialectics, and they are invisible. In this image, perhaps you see a young woman or an older woman, but it is both. If we learn the power of and, the way we see things, think about them, and feel may change. The power of and. The ability to hold dissonant things in mind is a marker of maturity, development, and cognitive ability. This psychological flexibility is a driving force behind emotional regulation and adjustment. It is hard to do. When diagnosed with cancer, an individual and caregivers are forced into chaos, and without a chance to practice or get used to or ease into the experience of holding new conflicting things at once. Cancer treatment requires consent or assent to treatments and medications that often add symptoms that you didn't have before, reduce quality of life, and leave long-term side effects and physical consequences. And as many patients say, cancer meds kill you before they save you. A dialectic. Treatment is like a dialectic equation, adding, subtracting, multiplying, added medical appointments, added side effects, missed days of school and work, missed exams, missed paychecks, lost fertility or mobility, added scars. Your hair is taken away and replaced by a wig. As scans are a common part of treatment, navigating scan results is another dialectic I hear so often. Being relieved that your scans are clean, yes. And also sad and anxious that they're still part of your life and you still have to deal with what they mean. Many have shared with me that they feel so much worse when everyone around them is so glad that their scans are clean. It's great job, you're so strong, that's amazing, you can move on now. But when only one side is acknowledged, it negates the other. So if you think about dialectics, when only one side of a dialectic is acknowledged, greater emotional distress and difficulty coping may be exacerbated. Both patients and caregivers alike sort of describe wanting people to understand what they go through and also saying, no, I don't ever want anybody to understand or to go through this. Social and identity development are impacted. A common theme described to me as being the same person but interacting with the world differently. Once a teenager described to me of not wanting to do chemo. She just relapsed, she knew what cancer treatment was like, and made a decision she did not want to do it. She wanted to keep her hair and attend prom in a few weeks, with the consequence of letting her cancer kill her. But she viewed this as valuing life and wanting to live fully. She did not want to die. She wanted to live fully with her social identity and her hair. You are faced with mortality when life is just beginning. It is not uncommon to think about not living or even suicide when living with treatment side effects are so intense, you've lost so much control, and life is so disrupted. Again, a dialectic. You are fighting for your life, but don't want to live this way. Giving space to talk about mortality can alleviate pressure and allow feeling more present and grateful for living in this moment. Talking about a negative, allowing a positive. It's also an invisible dialectic. It's a balance. I often describe parallel lines when describing, providing a visual for a dialectic. On one line, it's both true that you fear uncertainty in the future and unknowns, and on the other line, make plans, talk to friends, live life, start a family. They can both be true at the same time. Another invisible aspect of life impacted by cancer is when treatment ends, survivorship. When you faced cancer treatment, when you face mortality, life after treatment can make it hard to differentiate what other experiences are hard or easy. Coming off treatment can be both joyful and scary. Scary about the unknowns of the future, not seeing your doctors all the time, or the excitement of going back to what we say, quote, a new normal. With this in mind, distress with the transition off treatment may include invalidating other challenging things that really are hard. How can anything else be hard after cancer treatment? But both things can be true. Cancer treatment is hard, and development is hard. You can think about these cancer experiences along a continuum. Time and time again, I hear that things don't just end with cancer, it just changes. Not allowing this new normal to be acknowledged can increase anxiety or distress. Survivors can be both moving on and still impacted. If they are grappling with it, so should we. A way to move forward and foster mental wellness is to allow a dialogue of the dialectics. Let them live together. Give both a space to process and be true. Can caregivers in our community also normalize this? To not allow a numbing of an experience at the expense of being only positive or negative, stable or unstable. Resilience may grow with the tolerance of both and. Dialectics are a good way to validate yourself while still pushing for change, for acceptance. I often hear this skewed view of acceptance. So many people tell me this. It's like an assumption that accepting something means it's okay and I like it and I'm happy. That's not necessarily true. Accepting parts of life that are hard and hurt, like cancer, is challenging. It's difficult to face that phrase, it is what it is, good and bad. But this can also open the door for then making a choice aligned with your values, goals, and identity. Now I turn to you and us as a collective. Mental health services should be prioritized in all cancer centers as a standard to be proactive and normalize emotional challenges and dialectics that we expect and are appropriate. How can we, a family, friend, community, and world, how can we listen, receive, and react to these invisibilities? Perhaps even champion the invisible. Sometimes sitting with a dialectic and acceptance, even of a bad thing, can give you the freedom to move forward or to find a different solution. And sometimes it's just an opportunity to sit in an uncomfortable moment and learn to tolerate it. And what I believe is experience another way of seeing, empathizing, and being alive. We might consider grace with the imagery and language around cancer survivors being strong, survivors, brave. This might negate that it's not necessarily true. This might make them feel like they have to be strong and put a front that's not entirely genuine. And again, both may be true. We can support this unique age group by helping them talk about dialectics and build a tolerance to listening to their experiences, living with uncertainty and loss of control. Building this tolerance for the unknowns may be its own way of knowing, an own form of knowing. We can cultivate empathy and greater capacity for bearing witness to individuals' cancer experience during a complex developmental time. Our responses can be part of healing, resilience, and emotional well-being. It's hard, and it's so simple. Listen to them. Listen for the dialectics, acknowledge it, and stay present with both sides. The runway of cancer is long, especially when you're still young and you're still growing and learning about yourself and the world. These individuals are forced to live with visible and invisible impacts of cancer. Let us be part of the solution that fosters mental health, wellness, and the holding of and. Thank you.
Thank you so much, Marie, for such a powerful talk. So we'll start off the Q&A session, and I'll start off with my own question.
Sure.
So, what telltale signs indicating that these young people living with cancer are struggling with their mental health can caregivers or family and friends look out for?
It's a wonderful question and also individualized. I'm actually going to maybe flip that a little bit and aligned with what I've said that I often say to patients, you can't control other people, you can only control yourself. So when thinking about red flags and dialecticism, I think if you're a caregiver or a friend or someone say, well, what are my own red flags? Have I only been thinking about the positives? Have I only been saying, you're so great, you're so great, you're so great? And then maybe you want to give an opportunity to talk about some other aspect. And the younger a person is, the more they need modeling and examples of how to do that or how to express feelings. Many caregivers will say, well, they're not talking about sad things or being anxious. And I said, well, have you asked or talked about it yourself? They don't have the words yet to do that. Many families have worry jars in their house, and it doesn't mean you have to talk about it, but you have to give it space to exist and give it a chance.
All right, thank you so much. So I'll take a question from the audience if we have anything. Any questions? All right. It appears that we don't have any questions as of yet, but if you do, Marie will be around and very willing to answer any questions. So now I'll just, say thank you so much, Marie. You did amazing.
Thank you.